Our story begins with understanding just how common seizure disorders are, representing frequent neurological emergencies. Status epilepticus, a particularly severe form, carries a significant mortality rate, ranging from 25.3% to 38.5%. Delayed treatment can lead to irreversible brain damage and systemic complications, so rapid intervention is key. Seizures can become self-sustaining and resistant to standard anti-seizure medications, which means that veterinary clinicians need to respond quickly and efficiently. Traditionally, a seizure lasting less than 5 minutes was considered brief, while anything between 5 and 30 minutes was deemed prolonged. However, the International League Against Epilepsy and the American Epilepsy Society define status epilepticus as continuous seizure activity, or a series of seizures without full recovery of consciousness in between, lasting longer than 30 minutes. But here's where it gets interesting. Because most seizures are brief, intervention should occur much earlier. The International Veterinary Epilepsy Task Force defines status epilepticus as seizures lasting at least 5 minutes or 2 or more seizures without full recovery in between. This more immediate definition emphasizes the need for prompt action to prevent long-term consequences. Now, let's talk about cluster seizures. These are defined as 2 or more self-limiting seizures within a 24-hour period. High-frequency cluster seizures carry risks similar to status epilepticus, including neuronal damage and the potential to progress to status epilepticus. Without medication, these seizures are unlikely to stop on their own. Seizures can manifest differently, with varying levels of motor activity and consciousness impairment. In veterinary medicine, generalized tonic-clonic seizures are the most commonly reported form of status epilepticus. However, diagnosing convulsive and non-convulsive status epilepticus can be tricky, partly due to the limited use of electroencephalography, or EEG, in veterinary practice. Non-convulsive status epilepticus should be considered in animals with prolonged altered consciousness, especially after convulsive seizures have been managed or after general anesthesia is withdrawn. Ideally, EEG should be used in neurological cases with impaired consciousness to assess non-convulsive status epilepticus before treatment, but this might not always be feasible.